Колеги, ми продовжуємо робочі.
Continue working the Ukraine Crisis Media Center. Now we are going to speak about access to medicine for internally displaced people. Our speakers are Yuliana Supron, Acting Minister of Health of Ukraine, Victoria Savchuk, Advocacy Expert for Crimsos, Olga Kurishko, Crimsos, Ryudetsenko, Analyst of Crimsos, and Alexander Pushin, Representative of the Hospice for the Elderly. The floor is given to Victoria Savchuk. I am advocacy expert of Crimea SOS NGO. Thank you for joining us today. We're going to present the results of our survey that is called Access to Healthcare for IDPs. It's not a secret that according to the data presented by NGOs who help IDPs, the issue of access to healthcare for IDPs is a pressing topic. And IDPs often ask questions about healthcare issues. For the fourth year of war in Donbass and occupation of Crimea, this is important to provide IDPs with proper health care because these people are under constant stress and their health deteriorates and they need proper health care and proper health care services, and these needs are higher than in average citizens that are in other regions. And according to our survey, we see that there are some obstacles, and our today's briefing here is devoted to discussion of the main opportunities to resolve these problems concerning IDPs' access to healthcare, and also to think about the ways of further actions in order to provide healthcare for IDPs. And now the floor is given to Uliana Suprun, Acting Minister of Healthcare of Ukraine. Thank you for being with us today. So we are glad that she is here today with us, and she will inform us on the position of the ministry concerning this issue. At the ministry, we understand that these results concerning access to health care for IDPs, it's a very important question. We should understand problems better in order to resolve them, and such surveys provide us with the true information about the problems, and thus we can plan together with NGOs and state bodies in order to solve these problems. War is a great burden on economy and society, and this is also influences healthcare system. In Krasnogorivka yesterday there was a shelling, and the healthcare center was damaged and the hospital was damaged, and half of this hospital was ruined, and we cannot provide health care services for population. And in occupied region of Luganshina there are medieval situation, retrovirus therapy and TB drugs, they are not accessible, and the only source is the smuggling. They bring medicines, or our citizens go to controlled territories and get these drugs in hospitals there. And also we cannot monitor the situation concerning children, those who are in occupied territory. We do not know about vaccination, about polio situation there. the results of war and the annexation of Crimea forced people to leave, and there are many IDPs, and this is a great burden on economy. And 1.5 million patients are now in different regions, and it's a great burden for the healthcare system. And I do not want to shift responsibility. We were just not prepared for this, and we should be prepared for such situations. You know that this is not the first time that such things happen in Ukraine, and for many years our history shows that we should be prepared for such situations. We should understand that it can happen any moment. And the rights of citizens who leave their houses, they should be protected, whether these are the rights to social benefits or these are concerning healthcare. So I read the survey and I saw specific problems that were represented, and first is IDPs. They said that there is low healthcare quality of healthcare. The system does not work properly, does not provide quality service, does not provide services for free. We all pay for everything, not just IDPs, but all of us Ukrainians, and also violations of rights of IDPs, of their access to healthcare. They do not, they should be proper registered to be compensated for healthcare they get, and we should get rid of this registration that is made, because they are all citizens of Ukraine and they should be provided with proper healthcare, and also in the financing of healthcare problems concerning oncology and other severe diseases. And now there will be proper access to these kinds of medicines, and now we will spend more for state procurement in order to buy medicines and to provide them for free to our citizens. We see these problems and we try to solve them, but it is important to know this information in order to plan properly. Discrimination of IDPs by medical professionals. And maybe this is because of financing, because medical professionals, they do not see in IDPs people who can pay a lot of money for treatment, and maybe this is one of the reasons. So we should shift to the new system of financing of healthcare, when we will pay for services, and doctors at the first level of healthcare and an emergency, they should not get money from their patients, and on a second and third level there should be co-pay that should be open and transparent, and everyone should know what will be additional payment, and doctors should not discriminate the patients or differentiate between them. And doctors will get better pay. They will have better conditions for their work, and they won't be humiliated just to ask money from their patients. And this will increase quality for patients and for doctors, and their dignity also will increase. And also vulnerable IDPs, disabled people and chronically ill people. We should focus on this. And we do not have proper system of those who should provide for these people and adhere to those requirements that we provide as ministry, and many who are unfair, and we should know specifically when these problems arise in order to properly react on the situations. And IDPs and all Ukrainians, this is not only IDPs, maybe also the servicemen who came from war, who became disabled, those who for a long time live with the disability, and each year they confirm that they are disabled. So people with that do not have one leg, they should confirm each year that they do not have this leg. So we should also discharge those people who are unfair. We are not a law enforcement body. We cannot arrest a person or to send them to prison, but we can respond and react on the activity and do not provide them with the place of work if they are unfair. So the rules should be observed properly. And I would like to say that we should first, from the very start, I cooperate with NGOs, and this is a great organization who really care about people. Those IDPs, those are professional people. And sometimes they say that this is some sort of volunteer organizations. No, these are professionals who work in NGO at a high professional level, and due to them we have a lot of help, not only physical but also moral, psychological help. I know it 100%. Medical and social help for IDPs. Not only from Crimea, but also throughout Ukraine. I would like to thank Crimea SOS for their work at quality professional level, and I would like to thank for this survey. It is important to know the truth before starting to change the system in order to provide benefits to our consumers, citizens of Ukraine, whether they are IDPs or those who live in unoccupied or occupied territory of Ukraine. And third, lastly, I would like to remind about those reforms that are ongoing in the system of health care. On the whole, there are 4 draft laws that were submitted to Supreme Council. 6327 on state guarantees, and 3328, 29, and 47 to provide guarantees to servicemen who defend territorial integrity of Ukraine, and changes to the budget and other technical issues. And the Parliament should vote for these draft laws, and many issues that now exist, they will be resolved, and we won't be connected to this place registration. Our patients will be able to get health care where they reside, not just wait for some documents in order to be provided with this help. So our doctors, they will be paid proper salaries, and this services will be provided for free, and we will get medicines for oncology children. This will be guaranteed by state. And if this draft laws are supported in the Parliament and implemented starting 1st of July, a lot of issues will be simplified and even be resolved, and we will return value to human lives, to IDPs and all the citizens of Ukraine. Thank you for this invitation. Thank you for your work. And we hope that we will hear even about more details, about more needs, and how we can, together with your organization and together with others, to cooperate in order to improve the life of each Ukrainian, and also important to resolve the issues of IDPs, those who left their homes, and they are the most vulnerable group. They are under risk, and we should provide them proper health care. Thank you very much, Uliana. Thank you for being with us today. Thank you for these warm words, and we really value the cooperation with healthcare. And I would like to add that the Institute of Registration that exists in Ukraine, this Soviet past, and it plays a serious role concerning access of IDPs to different services, both medical, social, administrative, and it is important that the citizens, people who are in the territory of Ukraine, both IDPs and others, were able to freely have free access to services that is proposed by the state at the place where they physically reside. So this is really important, and I would like to say that at the entrance you may find the copies of our reports that we've prepared in Russian, Ukrainian, and English, and also there are roadmaps with contacts of organizations. And in April, May, they provide medical services to IDPs, and I would like to say that we will continue this research, and we will monitor constantly the issues of access to health care for IDPs, and we will cooperate actively in this with the Ministry of Healthcare, because this is not our last report, and in order to see the trends, to understand in what way the situation changes, because we do not know when this conflict in Ukraine and when those people who are IDPs now will be able to return back home. And moreover, we will constantly monitor the situation and contacts that we mentioned in the roadmap. Many organizations, they provide help, part of organizations, based on projects, and we will continue to update information in order that the information in our materials was up to date. So, do you have questions to Uliana?
No question. Then I will give the floor to my colleagues who will tell more details about research, which was mentioned by Ms. Suprun, and I told about it also, and there's a topic under discussion today. Our report is based on the data which has been collected via interviews of IDPs and survey of social research and analysis of legislation and analysis of addresses to Crimea SOS NGOs since 2016. It is also important to say that we, in this research, tried to demonstrate different attitudes and to provide proposals of IDPs themselves. I'm giving the floor to my colleague Yuri, to my colleague Sergei Yasenko. Thank you, Victoria. My name is Yuri Datsenko, analyst at the NGO Crimea Source. Thank you to everyone who came here to listen to us. We started this research at the beginning of this year. It will provide to analyze and to evaluate the access of IDPs to healthcare services according to the Ministry of Social Policy. As of May 15, 2017, there were 1,582,565 IDPs from the south and the Crimea due to peninsula occupation and the war in Donbass. These people suffer continuous stress, and they also lost their environment, their communication. IDPs say that they, due to stress, have deterioration of their diseases, especially this concerns children whose parents address us to find some psychologists, psychiatrists, psychoneurologists, and other specialists, special doctors. Most vulnerable are such categories as disabled people, elderly people, lone mothers, single mothers, due to long periods which pass when they re-register their status, they really lose much benefits. Analysis of addresses was conducted by CrimSource NGO. We analyzed results of IDP questionnaires, analyzed legislation of Ukraine. When we analyzed the addresses to CrimSource NGO, we found that IDPs need more legislative consultation, humanitarian assistance, also relevant and urgent are questions of surgical operations, on oncology, and payment for medicines. And also there were very many addresses for maternity medical kits. IDPs suffering chronic diseases named most often registration or re-registration of disability group. Now, currently, an IDP should go to a doctor, then go to a hospital, then get an opinion from the doctor, and after that to go to the commission, which will take a decision either to continue or to discontinue the disability group. But these disabled people very often do not have money to pay for stay in the hospital, so they do not re-register because of this, and their status of health is deteriorated. The big problem also is during our study, we found that many DPs pay for medicines and healthcare services which they, before displacement, received free of charge, because local budgets are formed without taking into account the number of ADPs. The problem also concerns of socially dangerous diseases. According to the data of the Ministry of Health Care, which started collecting data since 2015, as of 2016, there are 1,017 IDPs who live with HIV and AIDS. IDPs most often visit the outpatient clinics at the place where they permanently reside, but the number of tickets for examinations is limited. IDPs say that public outpatient clinics provide worse service than the unpaid clinics, and they go to public outpatient clinics in order to get certificates, but in order to improve their health, they go to private clinics. Without payment of voluntary contributions to the medical institution, IDPs often do not get any healthcare services. Some IDPs also mentioned that the biased attitudes of medical staff. But all IDPs, also our respondents, say that that during this visit to outpatient clinics, still they resolved the issues with which they address the same clinic. The main problems in the medical sector in Ukraine are low level of financing of the healthcare system in Ukraine, violation of IDPs' rights for access to medical services, lack of financings for programs of diabetes, cardiovascular, oncology, and other diseases treatment, discrimination of IDPs in outpatient clinics, and what are the solutions? The solutions could be to organize watchdog NGOs over the activities of state institutions and organizations, also to maintain benefits programs, preferences programs, and improvement of the education of medicines and transfer to insurance medical services. I am a lawyer at Crimsos organization, and I will present you the legal part of our research. Of course, our survey referred to legislation, and we analyzed the legislative framework in this sphere in the medical sector, which regulate medical services. The legislation is not very bad, but it is complicated to implement it. The right to due level of insurance of health is guaranteed by international and national legislation. This means that the state had the obligation to ensure due level of health of our population. As concerns IDPs, they get access to medical services according to territorial principles. This means that upon displacement, a person goes to a hospital or outpatient clinic and demonstrating his or her certificate of IDP, and this clinic should register this IDP. We have primary, secondary, and tertiary health care, which is provided either at the place of physical residence or in other places, urgent healthcare services should be provided to persons wherever they live. Third, opportunity to get free of charge or low cost medicines. There are two legislative and regulatory acts, the decree which supposes provision of free of charge medicines for special categories of our population. Our research provides provides the list of categories in the annexes, and also categories of people who are eligible for assistance. The fourth is different conditions in local and national programs for IDPs. This means the state programs, national programs, are financed only partially. Some measures of these national programs, they are funded. For example, the program of controlling oncological diseases and the national program diabetes. There are local programs which are partially being implemented via support from local budgets and national to local budget transfers. In the matter as concerns IDPs in these programs, part of the programs address only officially registered persons and do not cover IDPs who have been living for a long time in these localities. So sometimes people require long-term treatment. These programs do not cover them, and they cover only people who are officially registered and are members of local community. Next point is financing of state-owned medical institutions. They are funded from the national budget and local budget, and also medical insurance and charity foundations. My colleague already contributed to this description of this point. So payment of voluntary contributions is a right but not the obligation. Sometimes victims address us when if they would not have paid, they are not able to get any services. Short analytical data on provided funding for medical sector in 2017, subventions from the national budget to local budget for purchase of medicines and medical devices. The funding planned is 650,000 hryvnias. This is funding from local budget. Medical subvention from the national budget to local budgets for to cover current costs and regional programs. Planned funding is 55.5 million hryvnias. For the first time, this budget item funding has been increased dramatically. So we hope this budget item will be distributed accordingly. New programs are not created now. Some measures from already existing programs are funded. Our research concerns IDPs, but we also mentioned the problems of population living in the occupied territories of Ukraine before. The situation is due to the military conflict in the east of Ukraine, the access to medical services for those population group is hampered. The provision of medical services mostly is covered by Donetsk and Lugansk region medical institutions, which are located in the controlled by government territories of Ukraine. Here, low mobile groups of population, they physically can't cross the border, cross the control line and get some medical services. They need continuous medical services, otherwise they can die. These patients need to be provided healthcare services by mobile groups of doctors and continuous treatment of their diseases. The final point as concerns legal part of our survey, the governmental action plan. This is annual, this year's program. And concerns the national policy concerning people living in Donetsk and the Lugansk region, regions which are not controlled by the government. The program envisages that the people living in occupied territories, they can get access to social and medical services on the territory controlled by Ukrainian government, and the main point is that international organizations will facilitate that Ukrainian government will facilitate international organization in access to the occupied territories and provision of healthcare services to low mobile groups of population who suffer chronic diseases. I'm giving the floor to Victoria. Thank you, Olga. I would like to give the floor to the representative of Hospice for Elderly People, Alexei, who will tell us a little bit about Hospice and its people residing in this hospice and getting healthcare services there. Thank you. My name is Alexei Karpushin, NGO Допомога, social project Hospice for Elderly Persons. I would like to tell about our Hospice for Elderly People. It was established in 2004 in Alchevsk. Now we are situated in Arteminsk. We helped single elderly people and disabled elderly people. When the conflict started, we moved from there and took some our patients to Kiev region, Bravary district. The total number of people, volunteers, are a little more than 30 people. The main problems, the main challenges which we face, we should take account of specifics, that these people are elderly and also they are victims of the conflict. Psychologically, they experienced deep stress due to the warfare and they need medical services to be provided to them. We contacted medical institutions, and there is a doctor who we call. We have medical record books for each patient, and this doctor comes to us and examines our patients. There are our some of our patients need medicines. For example, we have a patient with suffering Parkinson's disease. When we apply for getting hospital services, first we are asked about physical residence registration. I listened to the speakers and I thought we help elderly people, we move them from the gray zone and we help them to get disability status certificates and other documents, because some people lack documents. One person was without one leg because and he had even Soviet Union's passport. Well, these people are elderly, they are disabled. How can they do and how can they resolve these matters on their own? This is impossible, I think. All these signatures and seals, when we help this person to get a passport, our patient 2 or 3 times was to visit this passport department. I would like to say that when I was getting documents for me, first I was to register at the physical place of residence, then I should also stick it into my medical records book. When I was a patient in the hospital for some period, I received free of charge medicines and free of charge healthcare services. I would like to express my gratitude to the doctors and this certificate that I am an IDP. This was the problem. Doctors' care depends on human factor. Last spring, my colleague moved from the gray zone, moved an elderly person from the gray zone to the hospital in Bravary, because that elderly man of 85 years old was in very poor health condition. When he arrived at 4:00 a.m. at Bravary Hospital, he faced very bad прием. attitude, very bad reception. We are people, and our country experiences hardships and warfare. So I want our doctors to demonstrate more humanity. I think that these people, IDPs and elderly people, they need human attitudes. They suffered the war. We have one female who was born during war times, and she's saying that now she will die during the wartime. I would like to express my gratitude to Crimsos for their assistance during all the time of our cooperation. They have been visiting us very often, and sometimes when they come, our patients are also very glad because they get the possibility to talk to someone, and communication, socialization. Thank you very much. Thank you, Alexei. We are also very grateful to you for your efforts and your devotedness to your cause. Colleagues, are there any questions? You are welcome.
Good afternoon, Olena. Irta Severodonetsk TV station. How are you going to defend the rights of IDPs in healthcare sector, and how are you going to defend the rights of these IDPs? While we prepared this report, I read a lot of forums, how people solve these problems, and they are guided by many provisions. People do not know information, and doctors do not inform them on issues, and in such case you should address chief doctor with the written request. Unfortunately, there are not many lawyers who accompany people in such situations, because this area is really specific, but sometimes it works. And also you can go along this way, but it can influence the quality of the service. It shows that the system needs reform, and the person has the right to defend their rights in the framework of legislation. And while preparing this research, we paid attention to the rights and informed about them, in order that people know that they can address to some institutions. And in the roadmap, there are organizations who provide services, and also there are NGOs and state organizations where you can address to get help, guaranteed help to realize your rights. Thank you, dear colleagues. Do you have other questions? Please ask. Olga and the Council of IDPs. But the scale of this problem and your analysis of the situation. Are these tens, hundreds, or thousands of cases, if we are speaking about IDPs, the healthcare and registration? We used sociological methods such as in-depth interview, and we cannot calculate whether these are thousands or hundreds of cases. We may only say about the problem, we can voice the problem. And about the quantity, this is for sociological surveys, but this problem is important. From 27 people we questioned, half of them said that their rights were violated. We would like to say about general conclusions we've made. Maybe someone else has a question. Do you have questions? UATV, we would like to ask about the number of people who were surveyed. 27 IDPs who were selected at random, and also the requests to our organization. 392 requests that were sent to our organization throughout the year. So final remarks, and we are ending. So this will be an addition to the answer of my colleague. So we didn't voice our recommendations, and I hope that you will read them in the report and you will support us concerning the violations of rights. There is no quality assessment. There is no specialized body or a hotline where you can call and inform, and many people do not speak about these things, and they do not address the institutions, and many medical institutions, they do not report on this. People informed us after many years of working with us, and this was the need for introduction of quality assessment and monitoring of cases of the medical care provision problems, because there are some situations when there are consequences that are really heavy, that can even cause the death of the patient. That's why we believe that the system should be improved, and IDPs, they are the citizens of the state, and the state should provide for them and defend their rights. And the right for health care is the fundamental right. That's why the state should do everything in order to provide healthcare services of quality. If you are in good health, you can find housing, employment, you can support yourself and be a real member of this territorial community. And from me, final remark is IDPs, we should not treat them as a problem. These are people who want to realize their potential in the new place of their residence. They were forced to leave their houses, and that's why we shouldn't condemn them, and we should have equal attitude to each citizen, to each foreigner, to each stateless person, to everyone who live in the territory of Ukraine, and provide them with the proper services that are envisaged by Ukraine. Thank you. Thank you for being with us. And we hope that this was useful.